Prescriptions for testosterone are rising in the U.S., and a significant level of that interest is coming from women in their 40s and 50s. So we've been already chatting up Dr. Pyle Coley, our medical expert, about this because we know this is trendy right now. And people are talking about a lot of buzz for this. But for women, it's kind of like, what?
Yeah, so it's interesting. So most of us don't know that women make testosterone naturally. In fact, it's not as high as men, about a 15th of the level of men, but our ovaries and our adrenal glands make a lot of testosterone. So around the age of 40, women start to have decline, not just in their estrogen and progesterone levels as part of menopause, but also in their testosterone levels. Men start to reduce their levels closer to the age of 30. But it really begs the question of, just because it's going down, do we need to replace it in order to make you live longer or feel better?
So yeah, take us back a little bit on this now. So when a lot of men now are being sold low T, like you're getting older, you need more energy, you should look into testosterone treatments. But women as well, that is something I think most of us would say that we didn't know about women and testosterone. This is becoming a thing.
Huge thing. In fact, it's all over social media, TikTok, influencers, medical spas, almost every naturopath you go to, they're talking about whether we should start replacing testosterone in addition to estrogen and progesterone for women around perimenopause or postmenopause. And there's very little science to actually back this. It's not in the guidelines.
I was going to say, you're talking about TikTok and social media, but I didn't hear you say the AMA or you know,
No, in fact,
Journal of Medicine.
Not a single FDA-approved indication for testosterone replacement in women. Now, you can use it in an off-label fashion. So some doctors are saying to some women that if you're really suffering, and the suffering would be symptoms like low sex drive, low energy, depression, sometimes maybe for bone density and some of the other functions testosterone have, they might reach for this. But again, it's pretty rare to do it for a medical reason. And the research behind the sex drive also doesn't seem to be very strong. In other words, women who are randomized to get testosterone versus placebo, which is just sugar, don't have that much of an improvement in their sexual function.
Sounds like it's something you could sell well.
Yeah,
like people want to hear this and go, oh, a
that's
pill?
Fixing a problem.
An injection? I want that.
Well, not only that, Tom, I'll say it makes you feel better. Anyone who gets testosterone, because it's an anabolic steroid, will have more energy, will have more pep in their step, will have, higher muscle mass and bone density and what have you, but that doesn't mean that it outweighs the risks of testosterone replacement, including the cardiovascular risk. We're trying to figure out if it causes heart disease, potentially risk of cancer in men, prostate cancer especially, as well as for women, conditions like deepening of their voice or
That's
acne.
what I was wondering, does your hair grow on your arms?
Absolutely, not just your arms and other areas. And a lot of these can be irreversible. So if you get too high a dose of this trendy testosterone replacement and your voice deepens, even if you stop that testosterone, it may not necessarily go back. So you really want to measure 10 times and cut once in this particular
But you also said this isn't just like a pill in some cases. Some people are going more like making a commitment to it, and you can't really just undo it.
Well, so you can take a pill, you can get a cream or gel, but a lot of women are getting these pellets. So I have, dozens of women in my office every month who say, oh, I have a testosterone pellet that my naturopath put in. And that's slowly leaching in that testosterone over many years, actually, months to years. And yes, you can get that pellet removed, but you don't know how the absorption of that testosterone is going. And again, with the paucity of data that we have for women getting this, is this the right thing to be doing to our postmenopausal women just because they feel better?
So when you talk about postmenopausal women and HRT, the hormone replacement therapy, even that is a bit of a guessing game as you start that as to what you need. This adds another kind of more random at this point element to that.
Very much. So yes, our traditional HRT has been estrogen and progesterone because that's what the ovaries made most of, and it went down. And the pendulum has swung away from absolutely not to maybe in some cases, although women who have heart disease, it's still absolutely not, breast cancer, absolutely not. But now adding testosterone replacement, which we know that when we take a pill, often the amount that ends up in our body is far more than what our ovaries would naturally produce or our adrenal glands would naturally produce. You're talking about supratherapeutic doses of an anabolic steroid in a population that hasn't really been studied. To me, there's more question marks than answers. And I really tell my patients to be extremely careful. There has to be a really good reason for a woman to go on testosterone replacement.
So at the end of the day, maybe go to see, like if you're considering that, your OBGYN versus a naturopath.
So OBGYN, a reproductive endocrinologist, a general internist, any of those doctors, because the naturopaths, again, a lot of them are going off of how you're feeling and trying to replete something that went away, but it's supposed to go away and your body likes that it's gone away. So,
okay. We all just want to feel better, Tom. Easy route is not always the best route. Thank you, Dr. Coley. You can find out more from Dr. Coley. Just go to 9news.com/Dr. Coley.